they are different from spinal nerves. One thing is this. In the spinal nerves, 31 pairs, they are sensory and motor. So we call them mixed nerve. But the cranial nerves, they are 3 pure sensory, 5 motor, and the remaining 4 of them both sensory and motor. So my study guide asks you the first question, which cranial nerves are pure sensory? Okay, which are the pure sensory? Is the 1 to 8. 1 to 8. So the pure sensory. Then the motor, there are 5. I will talk about that. And gradually, if you know their function, you can easily see they are the motor. Like a 3, 4, 6 for the eyeball muscle, 11 for the sternocleidomastoid and the trapezius, 12 for the glossal. Is for the tongue, hypoglossal. So just remember this time I emphasize the sensory, okay? But there are some pure motor and some both sensory and motor. So this is the way. This is already on your blackboard, okay, in the PPT. So we can start with the number 1, okay? The number 1 is a pure sensory, is an olfactory. So number 1 is olfactory, pure sensory. I really don't have many questions there. In general, if we do the cranial nerve examination on the clinic, doctors usually don't check your cranial nerve number 1, olfactory, unless you say I cannot smell anything, nothing. And in general, our olfactory senses already degenerating. It's basically compared to the animals, where just basically it's like no sensory here. So where is the start? We are not going to see olfactory nerve. Olfactory nerve is coming from the nose, olfactory epithelium. My old professor told me is this: put your pinkies into your nose. The tip of your fingernail is the olfactory epithelium. So you put it in and you pick on there is olfactory epithelium. Okay, and from there we have olfactory nerve pass through cribriform plate of the ethmoid bone. Okay, once pass through the bone into the skull, and this nerve is already changed another neuron. Okay, so this olfactory nerve is called the first neuron. Then we change it to the second neuron. I don't ask you those details, just whatever in my lecture notes. This neuron, the cell body start on the cribriform plate. So those cell body of the neuron make the olfactory bulb because you have cell body of the neuron. Then this neuron, the axons, form the olfactory tract. The tract will go to the eventually reach to the temporal bone. Where do they stop? Secondary stop at hypothalamus of the mammary body. We'll talk about it later. So it's a kind of first order neuron, second order, third order. We'll repeat in the 241. Any sensory from our touch, pressure, pain, temperature, also special senses, once get into the cerebral cortex, never go through one neuron, always 3 orders neuron. First order, second order, third order. And the second order always cross over. Okay, so we'll talk about the order in 241. So olfactory tract eventually reach to the temporal lobe, into the olfactory cranial area. Okay, are we good? So this is the first one, olfactory function, smile, pass through cribriform plate. That's number 1. Number 2, okay, so if we lost this nerve, we get nosemia. A is silent, nosemia is no smile, okay? Optic is also pure sensory. For the people who just come a little bit late, you need to highlight 128, lecture notes, page 106, 128, pure sensory. That's on my study guide, 128, pure sensory. The motor I will get through there. So the optic is pure sensory, starting with the retina, okay, in the eyeball retina. The optic nerve passes through the sphenoid bone, optic foramen or optic canal, depends on the book. Okay, once into the brain, some nerve fibers will cross over. The crossover part form the optic chiasma. Then the axon still traveling optic tract, then eventually reach to the occipital bone. Again, the details will be in 241 in the special senses. For now, just know the optic nerve. Optic chiasma I gave you on the other model on Friday, just optic nerve. And you're gonna see what is significance, why we need to know optic nerve, optic chiasma, optic tract. I will not ask you details, but I'm going to explain to you why we have those three names. What's the significance? It's like this. Okay. One, we have the retina. It's not dry, so. One more thing. The seminar, I've made a correction, is November 30th, is not November 20th. So if you go there and send your name and also class number 003, PS 24003, you get 5 extra credits. So this is the retina. Okay. Two medial side, we call the nasal portion. So this is the axon from the two medial. They all cross over. Okay. But if from the nasal side, lateral, okay, they do not cross over. Goes this way. Why any pens doesn't work? So I'm going to throw away this one. Second one, I'm going to throw away this one. So I'm going to throw away them. Okay. Then you have a lateral or temporal fiber. They do not cross over. Okay? So this is the optic nerve. So this is the nerve. I know none of the doctor. Okay? So this is the nerve. But this portion crossover is the chiasma. Okay? After crossover, still the same axons, still the same nerve we call the tract. And look at this picture. If somebody has a lesion on the optic nerve, like a cut off the optic nerve here, this person will get one eye, total blindness. In this case, left eye, so total blindness, so optic nerve. If there is no lesion on the optic nerve, such as through the optic canal and from the retina, optic nerve is fine. But then some lesion happened here, optic chiasma. So what happened to this person? Here, and then we have here. This person going to lose half of the eye lesion on both sides. So they do not see anything on the medial of the retina. So that's half of the eye is basically blindness on both sides. Do you follow me? But everything is all right except we lost the injury on the tract. If it's on the tract like this, so we have a lesion here, then we lost the vision on this eye medial, on this eye lateral. Very strange way. Because you lost this nerve and you lost this nerve. So that's the lesion. Follow me? And I just use this example, tell you how complex for the cranial nerve and for each subject. So what's happening in the future, you can continue to study. But now, you just know optic nerve beginning, crossover optic chiasma. Are we good? So that's why we have different names. So those are small ones. I will get new markers. Okay, optic nerve eventually reach to the occipital lobe, function vision. So I have a question, if we lost the optic nerve, we got no vision, so-called blindness. And the optic nerve is a pure sensory, okay? That is like on the cadaver, optic nerve, optic tract, optic chiasma. So that's number 2. Now we're going to look at a 3, 4, 6 together. 3, 4, 6 together. I have quite a few questions around here. First off, 3, 4, 6, they are all motor. They all supply eyeball muscles. The eyeball muscles is the skeletal muscles make our eyeball move up, down, medially, laterally, rotate, roll your eyes. Okay, so those are 6 muscles. Okay, number 3, ocular motor. Let's see together. Ocular motor. Ocular means eye, motor, eye movement. Number 4, trochlear. Let's see together. Trochlear. Number 6, abducens. Let's see together. Abducens. And they supply 6 muscles on the eyeball. Okay. They also have one thing in common. They all pass through the superior orbital fissure. You need to know which nerve supplies which muscle. So you may write down like this. Okay. So the number 4 supplies superior orbital, superior oblique. So number 4, SO. Why? Because this trochlear nerve comes named as there is a trochlear. The superior oblique is around the pulley. The pulley is called trochlear. So therefore, rotate your eyeball. So number 4, superior oblique. Number 6 supplies abducens, supplies lateral rectus. The lateral rectus pull your eyeball to the lateral, like abduction. So the nerve called abducens. So that's pulling away from the midline. So abducens, number 6. The remaining 4, so I wrote down here, remaining 4, superior rectus, medial rectus, inferior rectus, inferior oblique, all by cranial nerve. Number 3, ocular motor. So ocular motor supplies all the 4. Ocular motor, compared to all those 3, is the largest one. Ocular motor supply other muscles like the eyelid muscle, also lacrimal glands, and the smooth muscle on the pupils. But those we leave that just the skeletal muscle. So those 3 nerves supplies total of 6 muscles. You also need to highlight the smallest one among the 12 pairs is the trochlear nerve, number 4. Study guide asks you what is the largest, what is the smallest one. Smallest one is number 4. Okay, largest we have not reached there yet. Okay. One more thing on the lecture exam is this. If we have a lesion or cut, injury of those nerves, we get a muscles, atrophy, paralysis, but we do not lose our vision. We still can see, we just do not see very well. So what we get is this. Strabismus means lazy eye. Or you see the explanation, strabismus. So one muscle like rectus, medial rectus muscle cannot pull, but the lateral rectus innervated by another nerve still functional. So one straight this way, the other one can look at this side. But the medial rectus cannot move because your oculomotor nerve wrong. But your lateral 6 number abducens is still okay. So you look at this way, the other eye goes this way. Okay, ptosis means drooping of the eyelid. That is oculomotor wrong. And if somebody, like when we get older, we always have a little bit drooping of the eyelids. But somebody due to the disease is really, really covered vision, covered eye. So you can have a surgical procedure, insurance will cover that. And the diplopia means double vision. So you're going to have a abnormal vision, but your vision still exists. You just don't see well, you're still there, okay? So you have double vision and the lazy eye. The eyes do not look in exactly the same direction at the same time. Are we good? Okay, and I'm going to pause here, ask you a couple questions. What is the name of number 1? And pass through which bone? Which part of the bone? Cribriform of the ethmoid bone. What's the name number 2? Okay, optic is sensory, motor, or both? Pure sensory. And if we have optic nerve injury, we get what? Blindness. Either total or half. Somebody even get this called a quadrant blindness, like this. Because they are the optic nerve, once before reach to the occipital lobe, there is called a Mayer's loop. If you have vision there, you only lost 1 of the quarter of the vision. So they are very complex. Among those nerves, okay, which nerve innervates superior oblique muscle? Trochlea. Which one innervates all your superior rectus, medial rectus, inferior oblique, oculomotor? Which one is the smallest one? Trochlea. And is the 3, 4, 6, they are all motor? Yes, they are all motor, okay? And which opening all the 3 parts? Superior orbital facial, okay? When we have those nerve injuries, 3, 4, 6, are we going to lose our vision? No, just bad vision, okay? So far so good. Let's look at the trigeminal, number 5. Is the largest one. I want to highlight. The trigeminal, after my lecture, you will realize is both. Okay, after my lecture. For the cranial nerves, you need to know 12 names plus 3 names of the branches of the trigeminal. So you need to know 15 names. Okay, trigeminal 3 branches. The first one is ophthalmic. Ophthalmic, let's see together. Ophthalmic is called 5-1. So I go this way. Superior orbital facial, 3, 4, 5, 1, and 6. 3, 4, 5, 1, and 6. So 5-1, the first branch goes to the superior orbital facial. This branch is a sensory. So it's for around our eye region, all the skin and the muscles such as touch, vibration, pressure, okay, and the pain, temperature. So it's a somatic